started to suffer with an enlarged prostate back in 2015-16 and then self-managed it for a long time, too long, and I ignored it. I never took medication, only self-medicated with herbal remedies and that sort of stuff, but slowly and slowly it got worse and worse to the point where if I needed to go to the bathroom, I had to go there and then. I couldn't wait. If I was out shopping, I'd be looking bathroom to bathroom to make sure I wasn't having a problem. So I went to the doctor because I had that urgency. I thought I got a UTI, and that was no. Did my PSA, it was elevated. They found I got a enlarged prostate with BPH because they did all the tests. I did the ultrasound and the CT scans to see what was going on, and I got called and said, we need to catheterise you now.
The cause of an enlarged prostate is multifactorial, and the most likely cause is age. As you get older, due to changes in testosterone, your prostate enlarges, and as it enlarges, it starts to obstruct the urethra.
Often men with enlarged prostates may notice that their urinary flow is slowing down. They may feel that they're not emptying their bladder as much, and that can lead to having to go to the toilet more often, during the day and also during night. Patients sometimes will find that they may develop urinary tract infections. They can also get other conditions like bladder stones and find that they need to rush to the toilet a little bit more and find it difficult to start urination.
As a man of 70, most people have an enlarged prostate. So when it first started to affect me a few years before, you just accepted it and thought, well, it is what it is, there's not a lot I can do about it. And then eventually you get to the stage where you're desperate sometimes to go, and there's not a toilet nearby, and it does cause a problem. As it got worse and worse, what finally decided that I needed to do something was I went to the toilet 18 times in one night, which was very frustrating, but that's the worst situation I've been in.
Being catheterised and sustaining the UTI, I thought I was dying. It's the only way to describe it. I've never felt so ill. The thought of never having a catheter removed and being permanently catheterised was something I was not prepared to live with. You know, I didn't know how to get around that. The catheterisation kept me away from my rugby club for over 9 months because I was embarrassed.
When we're looking at treatment options for patients with urinary symptoms, we often start with lifestyle modifications. So we're looking at things in their diet which we may be able to optimise so that they go less often. But ultimately they may end up requiring medication, and then following medication we look at different surgical options. And the surgical options are very specific to the individual's anatomy and the patient's ambitions and what they want to achieve by going down this process. Aquablation therapy is a relatively new technology which has been available in the UK for a few years now. Aquablation uses water jets to remove prostate tissue. Now it starts off with real-time image guidance, so we can actually see exactly where the prostate is, and that allows us to offer a personalised treatment plan using water jets and avoidance of heat energy to optimise outcomes for patients.
What I liked about it was you felt as if the consultant was your friend. You weren't just a number. You weren't being like moved across, ready for somebody else to sit down and get done.
I think as a man, Christopher Blick understands the potential mental effects of being catheterised, having a prostate trouble, and all those emotional and mental health issues. And he had the ability to explain it to me in a way that I could understand and I could take it on board, which is why I chose it.
The majority of patients who have aquablation come into the hospital and stay for 2 days. That involves the procedure on the first day and usually have a catheter in for between 1 and 2 days, and that allows us to irrigate the bladder and make sure there's no further blood clots. After the procedure, we expect you to have a better flow than before, but it still takes a while for you to get absolutely back to your baseline. While you're in hospital for 2 days, you'd expect yourself to be up on your feet and mobilising within a few days after that, and then back to have your best urine flow within a month after the procedure.
As far as my operation was concerned, it was very quick. In fact, when I went under, it felt like 10 minutes later. I woke up in my room and they said, "It's all done." I said, "No, it's not. No, it's not. It can't be. They only put me under 10 minutes ago." And the next thing I know, someone is wheeling in some food. "There's your breakfast." I went, maybe it is done. So it was fantastic that in, out, sorted, thank you very much.
The recovery was really quick. As I say, I passed blood for 2 weeks, to the day. And then I went back pretty well to everything as soon as my body would let me. I actively still play rugby, I actively get in the gym, I actively get out and do physical work. I didn't notice that I was not able to do anything, whereas with a catheter, I could do nothing.
It's been seen on multiple trials to be safe when compared to the standard of care, whether that be TURP or HOLEP, and there's an increasing body of evidence to support its safety.
My view on the operation is don't be frightened of it. It's quite a simple operation. In fact, don't be frightened of being tested. So many people have found out by a simple blood test. You can have a little test, a little biopsy, which is not painful. Just go for it, because it could save your life. As far as Ramsay Healthcare is concerned, they're 5-star. Everything's there, done, sorted, in place, full marks to them.
Aquablation has been a godsend for me. It's given me my life back, because I think what it does is it allows a man's mental health to be maintained as well as his physical health. I would recommend Ramsay Healthcare 100%. I cannot thank them enough for the treatment they gave me, the respect that they gave me, and the follow-up contact. People have spoken to you after to find out how your experience was. So yeah, 100%.